Hey guys, it's Alan Anesthesia, and I bet you're wondering what is the best ICU experience to have to get into CRNA school. On all nurses, there was a comment that read, they usually look most highly upon a cardiothoracic ICU. There's a hidden myth that Honchos CVICU nurses are the smartest and most talented ICU nurses in all the advanced specialties. Now, I will admit, CVICU nurses have a wealth of knowledge that stems from the management of patients who are usually a mixture of surgical and medical. They are frequently exposed to the use of various critical care medications such as sedation, analgesia, and overall cardiac activity, and machines to improve ventilation, oxygenation, and hemodynamic status. Even though those things are true, admissions boards do not favor one ICU over another. Now, what CRNA schools do want are individuals who are knowledgeable, leaders in their environments, and are prepared to join their CRNA programs. It is imperative that you choose an ICU that interests you, whether the population be neonatal, pediatric, or adult intensive care. Now, although neonatal and pediatric intensive care are not always accepted experiences, these nurses are frequently exposed to pharmacological conversions and have mastered emotional intelligence and nonverbal communication. Now, let's talk about trauma levels. CRNA programs typically favor level 1 trauma centers because these hospitals are usually current on recent evidence-based practice and manage high acuity patients while providing various levels of resources to their staff. These can be great hospitals for learning, but there's usually a stigma to not allow new grads to manage the sickest patients at these level 1 trauma centers and to give those patients to more experienced nurses. So you could be the newest, most up-to-date level 1 trauma center, but might not have the experience of managing high acuity patients, being in leadership roles, or using advanced medical devices. For example, I worked at a level 2 trauma center, but through the initial surges of COVID-19, we operated as a level 1 trauma center, where we lacked resources and staff members. What this meant for me as a new grad was I had to learn, grow, and perform at an accelerated rate. And during my CRNA interview, when I was asked to discuss the patients I would typically manage, I was able to confidently display how I had managed highly acute patients with the use of various different pharmacological and medical interventions while being an impactful leader on my unit. When deciding a specialty within those populations, choose one that has always interested you, whether it be neurological, cardiovascular, STEMI, trauma, or even a general ICU. Once you decide the unit, it is time to focus on being teachable and humble, absorbing information, developing critical thinking, and mastering your skills. If you choose a unit where you're interested and feel supported, you'll naturally want to develop into a well-rounded candidate. You'll want to educate new graduates through being a preceptor, being resourceful as a charge nurse, and leaving impact through participating in unit council. These experiences will be seen as meaningful to not only you, but to CRNA programs, and not just things off of your task list. So, you've chosen your ICU. Let's talk about what really matters. You need to focus on what experiences you take away from the time you spend on the unit, and what you contribute. So let's talk about some things to focus on. With conditions and diseases, understand what things you'll typically see with a specific pathological change. How is it compared to normal physiology? Why is it presenting how it is now on a cellular and a clinical level? During your interview, you'll be expected to discuss what the device is, how it works, and your responsibilities and complications that can arise while using it. With medications, you need to first learn why they're typically used on your unit and how to safely administer them, and then become an expert on the following. 1, what kind of outcome would you expect to see in the patient in terms of vital signs and labs? 2, the common dosages. And 3, the common side effects and adverse reactions that can be expected. Then, once you become a master of these basic concepts, you'll need to learn how these medications physiologically manipulate the body to produce their effects. Overall, focusing on these things will allow you to show a CRNA program that you are focused on being more than just a technician, but a scientist in your practice. Let's recap. There is no ICU that is the best option, but there are factors that you have to consider. Medically, what level of acuity will I experience? What devices, medications, and conditions will I become familiar with? And then personally, how will I grow as a nurse within this unit? And what kind of impact can I leave on this environment? Thank you for watching, like and subscribe, and stay gassed up.